Hi, in this video I'd like to talk about bed rest and miscarriage management. So bed rest is something that is often recommended to patients who have experienced a potential miscarriage. So a potential miscarriage is what we call a threatened miscarriage. A threatened miscarriage can be happening within the first trimester. These types of threatened miscarriage we call early threatened miscarriage, and sometimes they also can happen within the second or third trimester. These are late threatened miscarriages. So a lot of doctors and hospitals would like to recommend their patients when they experience symptoms of threatened miscarriage. The number one recommendation they actually give is to have plenty of bed rest, try to move as little as possible to increase the chances of a successful pregnancy, to preserve the baby, avoid the pregnancy loss. So let's discuss whether bed rest is really a smart move. So bed rest has nothing to do with whether a miscarriage can happen or not. So a threatened miscarriage, a common symptom is that we will observe among patients is that first they will have some light vaginal bleeding, and then secondly is abdominal pains and also some pains in your lower back. These are the two key symptoms. That is a way of your body alarming you that a potential threatened miscarriage is going to happen. So how does bed rest actually stop a potential threatened miscarriage? A miscarriage can have multiple factors that are causing it. For example, hormonal causes. If you don't deal with the hormonal causes, how does bed rest stop the miscarriage from happening? Doesn't make sense. Secondly, if your miscarriage is actually caused by chromosomal abnormalities or uterine malformations or oxygen deprivation, malnutrition, how does bed rest stop these types of miscarriage from happening? So it doesn't make sense. But sometimes bed rest is recommended for those who are experiencing late miscarriages, because late miscarriages are caused by the premature dilation of the cervix. So we believe that the cervix is opening up too soon. So if you reduce activity, we might stop this. But to answer this question, your physical activity has nothing to do with the dilation of the cervix. The dilation of the cervix is caused by your cervical insufficiency, which means your muscles there are quite weak. The tissues there is quite weak. It cannot withstand the growing fetus. It's opening up because the growing fetus is expanding. The womb is expanding. That's why it's opening up. So your physical activity has nothing to do with stopping a miscarriage. So bed rest does actually more harm than good. Sometimes we also observe that when women have too much bed rest during pregnancy, they end up losing muscle mass, they end up losing bone mass, they end up going through malnutrition, dehydration, all of it affecting the quality and the development of the baby. This might cause a miscarriage. And furthermore, we've also observed in some cases that vaginal discharge that will flow back into the cervix because of excessive bed rest. Sometimes patients are even advised to hang their legs above their heads to prevent this miscarriage from happening. This will cause the discharge to flow back into the cervix, and this discharge carries bacteria, and this has a high risk of causing a bacterial infection in the cervix affecting the pregnancy, and this is what we call a septic miscarriage or septic abortion. So here at Antai Hospital, we never recommend bed rest for our patients. We recommend them to continue on your daily activity, do the normal activities that you do. If you can do sports, be active, but do not be still or inactive or lay in your bed. That will cause more harm than good. And to actually stop a threatened miscarriage, you need to deal with the root causes. So in Antai Hospital, if you have hormonal issues, then we will supplement your progesterone or estrogen. If you have a cyst or some form of growth, tumor that is affecting the pregnancy, then we need to do a surgery within the first trimester to stop it from affecting the pregnancy. So what we mean is that we need to treat the threatened miscarriage according to its cause and not just blindly recommend bed rest. In fact, we recommend that bed rest should be eliminated as a management method. So I hope you learned something today, and also if you'd like to find out more information about miscarriage management, what Antai Hospital does and specialize in, please visit our website and leave me a comment down below.